Yeah, Abhijit.
Uh, First of all, I would like to thank Dr. Vasa and Vivek sir for giving us this opportunity, for giving us this platform to share our experiences in order to bring the positive change in the life of brain injured patients. Thank you, Dr. Vasa ma'am and Vivek sir. So, good evening, friends. My name is Abhijit, and I'm father of 12-year-old Ojas, who is cerebral palsy. Through this webinar, I would like to share with you our 11 years of experiences in terms of contemporary treatments we tried for Ojas before starting Vasa concept. And I would like to also share our experiences with Vasa concept. I would like to also specifically mention that I have no intention to say anything negative to anyone, but just to present the facts and share our experiences. So, to start with our journey, Ojas was born on 22nd August 2007 at one of the well-known hospital in Bangalore. He was a 1 month preterm baby and didn't cry at the time of his birth. He had minor jaundice as well and hence shifted to NICU for 15 days. When baby got discharged after 15 days, everyone in the family was super excited to welcome the newborn baby at home. And next few months were really the happiest months of our life. When Ojas was 7 months old, he was suffering from minor cough and cold problems. So we had taken him to nearby pediatrician. At that time, she had noticed that Ojas' muscles were stiff compared to other babies, and she insisted us to consult the neurologist. After getting the opinion of our friends and relatives, we decided to consult one expert neurologist at Tardev, Mumbai. But you all know how difficult it is to get the appointment of the expert doctor. But somehow we could manage to get the appointment for the latter month. On the appointment day, when we reached hospital, it was long waiting outside her cabin. Baby was restless and continuously crying, and we were also really tired due to the long commute. Nearly after 2 hours, finally our turn came. We were really worried about what she will say about our baby, and we were hoping that nothing would be serious. After checking baby's history reports, she just asked us to get MRI and the EEG test done. We were listening these words first time in our life and had no idea about what this test meant for or how they are really done. But when we were taken to a large tube-shaped machine, and when the hospital staff made us just lie inside that tube, we really got scared. After nearly half an hour, when the MRI scan completed and the baby was in our arm, we breathed a sigh of relief. After the MRI, it was the time for EEG test. We were not in the condition to do any more test at all, but we had no choice. I mean, somehow we prepared ourselves and went for the EEG test. During the EEG, many number of electrodes were attached to the scalp of Ojas. Though it was a routine job for technician, we were really disturbed to see our 8 months baby in that condition. Finally, the test completed and we went to meet neurologist again. After checking reports, she told us that the baby got brain injury. He is a CP and there would be delay in achieving the milestones such as standing, walking, etc. And she asked us to start physiotherapy for Ojas. By the time we stepped out of her cabin, our mind went completely blank. It was the most disheartening moment of our life to hear all that about our innocent baby. Worrying about our baby's future, we started for home. And as per her advice, we started physiotherapy for our baby. And this was the start of our vicious cycle. Life started getting hectic as we had to commute for an hour on daily basis to the rehabilitation center, wait there for our turn, then do the physiotherapy for an hour, and by the time we come back to home, we used to fully exhaust. This routine continued for next few months, but without any visible improvement as such. His neck control was still poor. And most of the time he used to cry, and he was not cooperative at all during the physiotherapy. One day, physiotherapist asked us to consult the neurologist again because his muscles were too stiff to continue with the physiotherapy. On the second appointment, when we entered the cabin of that expert neurologist, we found that she was talking with a small group of her students. She then asked us to lie Ojas on the bed, and rather than understanding our concerns first, she had her students examine Ojas so that she could give some lessons to them. And that was a really annoying thing. But later, when we spoke to her about physiotherapist's concern and the muscle stiffness, she advised us to start Pacitane and the Rivotril tablets. She did not mention any side effects though. When we started these medicines, his muscles seemed bit relaxed, but it also made him very drowsy. He was not active at all. And moreover, he started suffering with the constipation. And this continued for the next 2 or 3 weeks. So looking all these negative side effects, we ourselves decided to stop this medicine as we could sense more harm than actual benefits. And we also stopped committing to rehabilitation center on daily basis because it was getting hectic. So we decided to do the physiotherapy from home itself. Today, when I look back and think about this whole incident about our neurologist appointment, I really wonder. I mean, in what way the neurologist help us to solve our actual problem? I mean, was her job only to make us undergo certain test for our baby, with which she could diagnose that the baby is cerebral palsy or not? And even if that was the case, how the patient was diagnosed as cerebral palsy before the MRI or any other machine for that matter was invented? I mean, I couldn't get that part. And I also do not understand how come the expert doctor suggests the drugs like Pacitane or the Rivotril. And these drugs are not only have many negative side effects, but it also make the patient's brain very weak. I mean, we are talking about the brain injury on one hand, and on other hand, in the name of treatment, we are making the patient's brain dull. I mean, honestly, I couldn't understand this part at all. I mean, being an expert in the field, we had really high hope from her, but it was unfortunate that she could not help us in terms of giving the solution to our actual problem. By the time we started the physiotherapy from home, Ojas turned 2. I just wanted to show you some pictures. I mean, how his condition was. So you can see when the Ojas was 2, his wrist were twisted, and there was the tightness in his hands. So we started the physiotherapy from home. Since he was 2 at that time, any normal baby start the walking at this age. So our physiotherapist also suggested that we should make the Ojas stand with some support. He did also mention that standing would really help him in terms of developing his leg muscles and improving the weight bearing capacity. We thought what physiotherapist is saying is right, and we started Ojas mixed stand with the help of AFO splint. But since his body itself was not ready to stand, he used to be scared of falling down, and then start cry and apply a lot of negative force. And without proper knowledge and the understanding of how the injured brain works, the physiotherapist, on the other hand, used to make him stand forcefully. And we as a parents had the impression that the physiotherapist knows everything and what he was doing right. So it was a complete mess. And most of the CP children have difficulty in speech and they cannot express their pain or trouble apart from crying. Same thing happened with Ojas. And we didn't understand what pain he was going through at that time. After a couple of months, we noticed that there was a discrepancy in the length. There was a discrepancy in his legs. When we asked physiotherapist about this, he told us that nothing serious. I mean, we should only put some additional coating to the splint with the shorter legs when we are making him stand. But there is nothing serious about it. Unfortunately, this forceful standing had resulted in the dislocation of his left hip, and because of which there was a discrepancy in the length of his legs. but we only came to know about it very later stage. We are still working hard to restore his dislocated hip. As there was no visible improvement with the physiotherapy, we tried our luck with treatments like Ayurveda, homeopathy, Reiki, etc., etc. But again, no visible improvement was seen with any of these treatments. As Ojas was growing old, we were also worrying about his education part, but due to physical limitation, it was not possible to give him the admission in the normal school. When Ojas was 8, we came to know about one government aided special school in Bangalore. Apart from education, the school also had the facility for physiotherapy, speech therapy, consulting, orthopedic, etc. etc. Though there were similar schools in Mumbai, commuting on daily basis was very difficult. So considering the different pros and cons, we decided to shift to Bangalore and give him admission there with the hope that he could at least socialize with other children there and also could get benefits of the different therapies. Special chairs provided by the schools were made of wooden material, and with the help of chest belt, children used to sit in that chair during the morning class. Due to the excessive muscle stiffness, Ojas was not comfortable in that chair, and we had to get him another chair with soft cushion. But again, we had to make him sit with external support only. Things were fine until one day, physiotherapist suggested to go for the buttocks treatment. We had stopped muscle relaxant long back, and we were also worried about Ojas' excess muscle tone. And moreover, the contracture were also developed in his joints. So we went for a buttocks and also did extensive physiotherapy post buttocks with the hope that his muscle tightness would reduce. However, unfortunately, his muscle stiffness still remained the same, and we didn't see any improvement in that part. Looking at his condition, the orthopedic surgeon who used to consult in that school, he convinced us to go for the adductor tenotomy surgery. As a parent, our situation was like lost in the dense forest and not finding any way out. We had no other option than trusting the person showing us any way. Unfortunately, we still regret that we trusted the wrong person who was orthopedic and only had the good knowledge about the surgery of the fractured bone, but he had no knowledge about how the injured brain works and what really needs to be done about spastic muscles which are resulted due to the brain injury. On the day of operation, when the hospital staff shifted him to anesthesia room, everyone from our family was crying inside and consoling each other. Post adductor surgery, when Ojas came out of the operation room, we saw that the plaster was put on both of his legs with horizontal separator. And we were not told anything about this before the surgery. We were completely shocked to see that. And we were worrying, I mean, how he could properly sleep in this position, and even how he could pass the urine in that difficult position. Next 2 to 3 weeks were most painful days of our life due to plaster on both of his legs and the separator. I mean, it became challenging for the Ojas to do even the basic movements. Moreover, he was having the unbearable post-surgical pain for which the doctor had prescribed the sedative drugs. Let me just show you the photo after surgery. So you can see this was the condition. I mean, you can see, and you can also see, the plaster on both of his legs. I can bet that any normal person like you or me cannot remain in that position even for a day. But here, the innocent baby had to go through this painful process for 3 weeks. Everyone in our family was psychologically disturbed. But we got some relief when the plaster was removed after 3 weeks. But like any other treatments, surgery also not provided any benefits in terms of improving the situation. On the contrary, it only worsened the situation. When the Ojas mind now filled with all negative experiences. Decision to shift to Bangalore and getting the Ojas admitted to special school turned completely wrong, as there was no kind of visible improvements, even after trying the Botox and the adductor release surgery. Meantime, I heard about some other treatments like stem cell and the hyperbolic oxygen chamber and few others, but fortunately, we did not go for it. When I look back and think about all our journey before the Vasa concept, I realized that none of the treatments we tried for Ojas provided any positive results, but it only added the pain and suffering. And ironically, not a single doctor was responsible to this. Agreed. All the doctors and the physiotherapists we consulted were doing the treatment based on what was taught to them, but no one also questioned the efficacy of the treatment, and no one had any clear roadmap or the goals for the recovery of Ojas. Whatever the positive changes the doctor used to claim, like reducing the spasticity due to muscle relaxant or any other for that matter, all of them were illusionary in nature, but it was not the true recovery at all. I realized that all these treatments are actually reactive in nature, when in actual they should be proactive. I mean, the typical approach was like, if any child has any stiff muscles, okay, give him muscle relaxant. If any child has developed the contracture, let's try Botox. Hip is dislocated, surgeon is ready. I mean, don't you all agree that this kind of reactive approach will be harmful to child in the long run? No one really tried going to the root cause and understand what actually causing the stiffness in muscle, or why the contracture is getting developed in the first place, or what could be the reason for the dislocation of the hip and how that could have been avoided. I mean, these questions were really important. Keeping in mind the critical challenges that CP children and their families have to face on day-to-day basis, we can't really afford this reactive treatment anymore. And as a responsible doctors, don't you all agree that time has come to think out of the box and focus more and more on the proactive solutions, so that the issues like contracture and the hip dislocation and the fracture due to low bone density will not surface anymore, and the child will not have any pain or trouble unnecessarily. After all these negative experiences with Botox and surgery and all the physiotherapy, we had almost lost all hopes and didn't know what to do next. But one fine day, while surfing on net, I came to know about Dr. Rajul Vasa and Vasa concept. And it was the major turning point of our life in terms of bringing the positive change.